Good day, everyone. I am P. Marveth P. Moreno, a student nurse from Visayas State University. And in today's video, I will talk about gastric cancer. So let's get started. Gastric cancer. So in this presentation, the contents are the following. First, the definition, followed by the stages of gastric cancer, then the pathophysiology, the risk factors, the clinical manifestations, the assessment and diagnostic findings, the medical management, the nursing diagnosis and nursing interventions, and lastly, the prognosis. What is gastric cancer? Gastric cancer is a disease in which malignant or cancer cells form in the lining of the stomach. So the wall of the stomach is made up of 5 layers of tissue, from the innermost layer to the outermost layer. So the layers of the stomach wall are the mucosa, submucosa, the muscle, the subserosa, or the connective tissue, and lastly the serosa. Usually, gastric cancer begins in the mucosa and then it spreads through the outer layers as it grows. What are the stages of gastric cancer? The following stages are used for gastric cancer. First, the stage 0. Stage 0 is also called the carcinoma in situ. So the cancer is found only on the surface of the epithelium. The cancer has not grown into any other layers of the stomach. Next is stage 1. Stage 1 is classified into two, the stage 1A and the stage 1B. First, stage 1A, meaning the cancer has grown into the inner layer of the wall of the stomach and it has not spread to any lymph nodes or other organs. In stage 1B, stomach cancer is called stage 1B in either of these two conditions. First, the T1N1M0, meaning the cancer has grown into the inner layers of the wall of the stomach and it has spread to 1 to 2 lymph nodes but not elsewhere. Next is T2N0M0, meaning the cancer has grown into the outer muscular layers of the wall of the stomach but it has not spread to the lymph nodes or other organs. Next is the stage 2. It is also classified into two, the stage 2A and the stage 2B. So stomach cancer is called stage 2A for any of these conditions. First, the T1N2M0, meaning the cancer has grown into the inner layer of the wall of the stomach and it has spread to 3 to 6 lymph nodes but not elsewhere. Next, the T2N1M0, meaning the cancer has grown into the outer muscular layers of the wall of the stomach and it has spread to 1 to 2 lymph nodes but not elsewhere. And lastly, the T3N0M0, meaning the cancer has grown through all the layers of the muscle into the connective tissue outside the stomach. And it has not grown into the peritoneal lining or serosa or spread to any lymph nodes or surrounding organs. Stomach cancer is called stage 2B for any of these conditions. First, T1N3AM0, meaning the cancer has grown into the inner layers of the wall of the stomach and it has spread to 7 to 15 lymph nodes but not elsewhere. Next is the T2N2M0. The cancer has invaded the outer muscular layers of the wall of the stomach and it has spread to 3 to 6 lymph nodes but not elsewhere. And the T3N1M0, meaning the cancer has gone through all the layers of the muscle into the connective tissue outside the stomach but has not grown into the peritoneal lining or serosa. And it has spread to 1 to 2 lymph nodes but not elsewhere. Lastly, the T4A-N0M0, meaning the cancer has grown through all of the layers of the muscle into the connective tissue outside the stomach, and it has grown into the peritoneal lining or serosa, but it has not spread to any lymph nodes or surrounding organs. Stage 3 is classified into three: the stage 3A, stage 3B, and stage 3C. So first, let's tackle about stage 3A. Stomach cancer is called stage 3A for any of these conditions. The T2M3AM0, the cancer has grown into the outer muscular layers of the stomach wall, and it has spread to 7 to 15 lymph nodes but not to other organs. Next is the T3M3M0, meaning the cancer has grown through all of the layers of the muscle into the connective tissue outside the stomach, but has not grown into the peritoneal lining or serosa. It has spread to 3 to 6 lymph nodes but not to other organs. Next is T4AN1M0, meaning the cancer has grown through all of the layers of the muscle into the connective tissue outside the stomach, and it has grown into the peritoneal lining or serosa and has spread to 1 to 2 lymph nodes but not to other organs. Lastly, the T4B-N0M0, meaning the cancer has grown through all of the layers of the muscle into the connective tissue outside the stomach and has grown into nearby organs or structures. It has not spread to any lymph nodes or distant parts of the body. Stomach cancer is called stage 3B for any of these conditions. So first is the T1 or T2 and 3B M0, meaning the cancer has grown into the inner layer of the wall of the stomach or the outer muscular layers of the stomach wall, and it has spread to 16 or more lymph nodes but not to distant parts of the body. Next is T3 and 3A M0, meaning the cancer has grown through all of the layers of the muscle into the connective tissue outside the stomach but has not grown into the peritoneal lining or the serosa, and it has spread to 7 to 15 lymph nodes but has not invaded any surrounding organs. The next is the T4A and 3A and M0, meaning the cancer has grown through all of the layers of the muscle into the connective tissue outside the stomach and has grown into the peritoneal lining or the serosa, and it has spread to 7 to 15 lymph nodes but has not spread elsewhere. Lastly is the T4B N1 or N2 M0, meaning the cancer has grown through all of the layers of the muscle into the connective tissue outside the stomach and has grown into nearby organs or structures. It may or may not have spread to 1 to 6 lymph nodes but not to distant parts of the body. Next stage is the stage 3C. It can either of these condition. So first is the T3 or T4A and 3B M0, meaning the cancer has grown through all of the layers of the muscle into the connective tissue outside the stomach and may have grown into the peritoneal lining or the serosa, and it has spread to 16 or more lymph nodes but not to distant parts of the body. Next is the T4B N3A or N3B M0, meaning the cancer has grown through all of the layers of the muscle into the connective tissue outside the stomach and has grown into nearby organs or structures, and it has spread to 7 or more lymph nodes but not to other parts of the body. So the last stage of gastric cancer is stage 4, meaning the stomach cancer describes as a cancer of any size that has spread to distant parts of the body in addition to area around the stomach. And there's what we call the recurrent cancer, meaning the cancer that has come back after the treatment. It may be a localized recurrence, which means it has come back in the place where it started, or it may be a distant metastasis, which means it has come back in another part of the body. So those are the stages of gastric cancers. Next, the pathophysiology of gastric cancer. Most gastric cancers are adenocarcinomas. They can occur anywhere in the stomach. So the tumor infiltrates the surrounding mucosa, penetrating the wall of the stomach and adjacent organs and structures. So the liver, the pancreas, the esophagus, and duodenum are often already affected at the time of diagnosis. Metastasis through lymph to the peritoneal cavity occurs later in the disease. So what are the risk factors of gastric cancer? First factor is the diet. A diet high in smoke, salted or pickled foods, and low in fruits and vegetables may increase the risk of gastric cancer. So the other factor of gastric cancer may include the chronic inflammation of the stomach, the smoking, pernicious anemia, gastric ulcers, previous subtotal gastrectomy, and the genetics. Also, being older or male, or having a mother or a father, sister, or brother who has had stomach cancer. What are the clinical manifestations of gastric cancer? So the symptoms of gastric cancer are classified into two: the symptoms of early disease and the symptoms of progressive disease. First is the symptoms of early disease, such as pain relieved by antacids, resemble those of benign ulcers, and are seldom definitive because most gastric tumors begin on the lesser curvature of the stomach, where they cause little disturbance of gastric function. So, next symptoms of progressive disease include dyspepsia or the indigestion, early satiety, weight loss, abdominal pain just above the umbilicus, loss or decrease in appetite, bloating after meals, nausea and vomiting, and symptoms similar to those of peptic ulcer disease. The assessment and diagnostic findings for gastric cancer. So, the physical examination is usually not helpful in detecting the cancer because most early gastric tumors are not palpable. So, these four assessment and diagnostic findings can help to assess gastric cancer. First is the esophagogastroduodenoscopy. For biopsy and cytologic washings is the diagnostic study of choice. And a barium X-ray is a series of X-rays of the esophagus and stomach. So it is where the patient drinks a liquid that contains barium or a silver white metallic compound. So the liquid coats the esophagus and stomach and X-rays are taken. So this procedure is also called an upper GI series. And a barium X-ray examination of the upper GI tract may be also performed. Next is the CT scan or the computed tomography, which completes the diagnostic studies, particularly to assess for surgical resectability of the tumor before surgery is scheduled. So CT scan of the chest, abdomen, and pelvis is valuable in staging gastric cancer. Lastly, the endoscopic ultrasound is also an important tool to assess tumor depth and any lymph node involvement. What are the medical managements for gastric cancer? So there are different types of treatment for patients with gastric cancer. Surgery is the common treatment of all stages of gastric cancer. So the following types of surgery may be used. First is a subtotal gastrectomy, meaning the removal of the part of the stomach that contains cancer, nearby lymph nodes, and parts of other tissues and organs near the tumor. So maybe the spleen may be removed. Next is the total gastrectomy, meaning the removal of the entire stomach, nearby lymph nodes and parts of the esophagus, small intestine, and other tissues near the tumor. So the spleen may be removed. Then the esophagus is connected to the small intestine so the patient can continue to eat and swallow. The next is the gastrojejunostomy, meaning the surgery to remove the part of the stomach with cancer that is blocking the opening into the small intestine. Next therapy for gastric cancer is targeted therapy. It is a type of treatment that uses drugs or other substances to identify and attack specific cancer cells. Targeted therapies usually cause less harm to normal cells than chemotherapy or radiation therapy. Next is monoclonal antibody therapy. This type of therapy uses antibodies made in the laboratory from a single type of immune system. These antibodies can identify substances in cancer cells or normal substances that may help cancer cells grow. So, the antibodies attach to the substances and kill the cancer cells, block their growth, or keep them from spreading. So the monoclonal antibodies are given by infusion. They may be used alone or to carry drugs, toxins, or radioactive material directly to the cancer cells. So those are the medical managements for gastric cancer. What are the nursing diagnoses for gastric cancer? Based on the assessment data, the patient's major nursing diagnosis may include the following: anxiety related to the disease and anticipated treatment, imbalanced nutrition, less than body requirements related to early satiety or anorexia, pain related to tumor mass, and deficient knowledge regarding self-care activities. So what are the nursing interventions for the said nursing diagnosis? First, there is reducing anxiety. The nurse encourages the family or the significant other to support the patient, offering reassurance and supporting positive coping measures. The nurse also advises the patient about any procedures and treatments so that the patient knows what to expect. In promoting optimal nutrition, the nurse encourages the patient to eat small, frequent portions of non-irritating foods to decrease gastric irritation. Food supplements should be high in calories as well as vitamins A and C and iron to enhance tissue repair. The nurse monitors the IV therapy and nutritional status and records the intake and output and daily weights to ensure that the patient is maintaining or gaining weight. In relieving pain, the nurse administers analgesic agents as prescribed. A continuous IV infusion of an opioid may be necessary for post-operative or severe pain. The nurse routinely assesses the frequency, the intensity, and duration of pain to determine the effectiveness of the analgesic agent. So the nurse also works with the patient to help manage pain by suggesting non-pharmacological methods for pain relief such as positioning, imagery, distraction, relaxation exercise, back rubs, massage, and periods of rest and relaxation. So for teaching patients self-care, the nurse teaches the patient and the family about diet and nutrition, treatment regimens, activity and lifestyle changes, pain management, and possible complications. So consultation with the dietitian is essential to determine how patients' nutritional needs can best be met at home. So the nurse teaches the patient or caregiver or the significant others about the administration of enteral or parenteral nutrition. What is the prognosis of gastric cancer? The prognosis of gastric cancer is generally poor. The diagnosis is usually made late because most patients are asymptomatic during the early stages of the disease. Most cases of gastric cancer are discovered only after local invasion has advanced or metastases are present. So there are certain factors affect prognosis or chance of recovery and treatment options. So the prognosis and treatment options depend on the following. First stage of the cancer, whether it is in the stomach or only has spread to lymph nodes or other places in the body. Then, when the gastric cancer is found very early, there is a better chance of recovery. And the patient's general health. So, gastric cancer is often an advanced stage when it is diagnosed. At later stages, gastric cancer can be treated but rarely can be cured. Taking part in one of the clinical trials being done to improve treatment should be considered. Thank you guys for watching, and I hope you've learned something about gastric cancer. So God bless everyone.